Good morning everyone, my classmates, the Dean of our department, and also to our instructor, Mrs. Jen Bernaldez. Good morning, ma'am. I'm going to introduce myself. I am Abigail Arain, taking up Bachelor of Science in Nursing. I am from Section Topaz, Level 1. So, I'm going to discuss about this lesson of Covid-19 and the SARS coronavirus. Coronavirus falls into a large group of viruses that it can be found or it would find in animals around the world. So just please listen on how these viruses spread and where does it came from and a lot of topics. So okay, thank you guys.
Introduction. This lesson is on the new coronavirus from Wuhan, China, otherwise known as 2019 nCoV. So coronaviruses falls into a large groups of viruses. There's thousands of it that would found in the animals around the world. So a subset group or smaller group of those viruses can actually known to infect humans. Coronavirus infectious disease 2019 is the name of this disease. Okay, the organ involved in this COVID-19 is the respiratory and gastrointestinal system, just like the other coronaviruses that can cause respiratory and gastrointestinal infections. Due to it allows to bind into respiratory and gastrointestinal cells with its viral proteins, and it can lead to variable respiratory and possible gastrointestinal symptoms. COVID-19 is a beta coronavirus like MERS and SARS, all of which have their origins in bats. The mode of transmission of COVID-19, according to the current evidence, is primarily transmitted between people through respiratory droplets and contact routes. Human coronavirus spread by coughing, sneezing, and close personal contact, such as touching the mouth, nose, and eyes. How we can prevent from this COVID-19? So, we should wash our hands with soap and water for 20 seconds. Use an alcohol-based sanitizer instead, and avoid close contact. Avoid travel to affected areas. Respiratory hygiene. Avoid touching your mouth, nose, eyes, face if hands are not washed. And then wear your face mask. The pathogen of COVID-19 is coronavirus, which falls into a large groups of viruses. There's thousands of it that would find in animals around the world. So the signs and symptoms of COVID-19 is fever, dry cough, and tiredness. That's the most common symptoms. So the less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discoloration of fingers or toes. The serious symptoms are difficulty of breathing or shortness of breath, chest pain or pressure, loss of speech or movement. The laboratory diagnosis of COVID-19 are the viral genome detection by RT-qPCR, antigen detection, electron detection, isolation, serum antibody detection, nasopharyngeal specimen collected by a healthcare professional, preferred specimen if available. An oropharyngeal throat specimen collected by a healthcare professional. A nasal mid-turbinate swab collected by a healthcare professional or by a supervised on-site self-collection using a flat tapered swab. Patient care or nursing considerations of COVID-19. Monitor the vital signs. Monitor the patient's temperature. The infection usually begins with a high temperature. Monitor the respiratory rate of the patient and A shortness of breath is another common symptom. Monitor the oxygen gas saturation because respiratory compromise results in hypoxia. Maintain respiratory isolation. Keep tissues at the patient's bedside. Dispose secretions properly. Instruct the patient to cover the mouth when coughing or sneezing. Use masks and advise those entering the room to wear masks as well. And place respiratory stickers on chart, linens, and so on. Enforce strict hand hygiene. Teach the patient and folks to wash hands after coughing to reduce or prevent the transmission of the virus. Manage hyperthermia. Use appropriate therapy for elevated temperature to maintain normothermia and reduce metabolic needs. Educate the patient and folks. Provide information on disease transmission, diagnostic testing, disease process, complication, and protection from the virus. Introduction: SARS. Severe acute respiratory syndrome is a viral respiratory illness caused by a coronavirus. SARS-CoV is thought to be an animal virus from an as yet uncertain animal reservoir, perhaps bats, that spread to other animals, civet cats, and first infected human in Guangdong province of southern China in 2002. The name of this disease is SARS. The system involved respiratory system. So here's the pathogen of SARS. It is the strain of coronavirus. The reservoir and mode of transmission of SARS. The reservoir of SARS is animal, so it is the civets. The mode of transmission of SARS is predominantly transmitted through close person-to-person contact via the respiratory droplets produced when an infected person coughs or sneezes. So the droplet spread can take place when the droplets from the cough or sneeze or of an infected person are propelled a short distance and deposited on the mucous membranes of the mouth, nose, or eyes of the persons who are nearby. So the virus can also spread directly or indirectly when a person touches a surface or an object uncontaminated with infectious droplets and then touches his or her mouth, nose, or eyes. The symptoms of SARS include a high temperature, fever over 38 degrees Celsius or 100.4 Fahrenheit, extreme tiredness or fatigue, headaches, chills, muscle pain, loss of appetite, diarrhea. It can affect your lungs and airways, your respiratory system, leading to additional symptoms such as a dry cough, breathing difficulties, and increasing lack of oxygen in the blood, which can be fatal in the most severe cases. Laboratory diagnosis of SARS. So I have two encoded laboratory diagnoses of SARS, the molecular test PCR and the cell culture. Molecular test PCR, real-time polymerase chain reaction, or the PCR, or real-time PCR or qPCR technique is identifying whether a target's genetic sequence of the DNA or RNA, example the cancer gene, a bacteria or virus in humans, animals, or in the food distribution supply chain, or specific attributes of a seed variety in agriculture is present in a given sample. The cell culture are used as model system to study basic cell biology or biochemistry, to study the interaction between the cell and disease-causing agents like bacteria, virus, to study the effect of drugs, to study the process of aging, and also it is used to study triggers for aging. That's how SARS would be diagnosed. SARS nursing consideration. Radiological changes were observed to progress from unilateral first week of admission to bilateral opacities 2 weeks after. So the main reason for ICU admission of these patients were progressing dyspnea and hypoxemia, requiring mechanical ventilation. All patients admitted to ICU were mechanically ventilated have more than 2 intravenous catheters, an arterial line and nasogastric tube, and then the indwelling catheter. So some patients required chest drain for pneumothorax. Care of patients in ICU were focused not only towards providing respiratory, cardiovascular, renal, gastrointestinal support and monitoring, but most importantly, patient and family support.